Growing concern after a third case of measles is confirmed in our state. But tonight, there are worries the spreading outbreak nationwide could have major impacts here. Hello, everybody. I'm Rick Ritter.
And I'm Mary Bubala. Health officials have been pushing to vaccinate to try and slow the spread of the disease, especially as two religious holidays approach and people travel to other affected areas.
WJZ is live tonight. Kimberly Eaton with what doctors have to say about that now. Kimberly.
And Rick, with people planning to travel for Passover and Easter, there is the risk of exposure to measles in other states that are also going through outbreaks. So tonight we asked doctors how folks can protect themselves. Maryland hit the tipping point Wednesday with a third case of measles confirmed. It is now, by CDC standards, considered an outbreak of the dangerous illness.
I'm very concerned now.
Mordecai Goldstein works at one of the two grocery stores in Pikesville where these flyers warn of possible exposure to the disease. The alert issued just before two religious holidays has him questioning his Passover travel plans.
That made me think I got to get vaccinated. Right. And because Passover's coming, I'm going up to New York to my sister, and my sister's pregnant.
Health officials are pushing for anyone without the vaccine to get it immediately, holding 2 free clinics in the last week.
So typically 7 to 10 days is when it starts working and then is pretty much effective from there on out.
Dr. Scott Krugman says most of the people coming to those measles vaccine clinics have had 1 dose, but not the booster. He says that gives a 90 to 93% chance of immunity. The second dose bumps that to 97%. Dr. Krugman says if someone were to travel to an area with an outbreak and was exposed, they do have a short window to get the vaccine and it will begin working. But he says start with a phone call to a physician.
Our goal with this is to limit the exposure, limit the spread, and by doing so and by being aware of what you've been exposed to and what your potential for exposing others is will help a lot.
And health officials really want to emphasize if you think you've been exposed, they ask that you don't go to the hospital. They say call your doctor first. Reporting live tonight in Baltimore, I'm Kimberly Eaton for WJZ.